To get settled, make sure your cup of coffee is nearby, whatever you need to do, and we'll get started in just a couple of minutes. Happy to have you guys here. Alrighty, we'll go ahead and jump on in. We've got a full agenda for today. So welcome again, everybody. We're really happy to have you guys here. I'm just going to start off with a few logistics. So the first thing, as you guys are probably all very used to by now, please use the chat feature. We want to hear from you guys. Feel free to type questions in the chat, to say hi, to make comments, to tell jokes, whatever it is. Please feel free to use the chat. We would really love to hear from you. We do ask that you keep your video and your microphone off, so you keep yourself muted and you keep your video off just to minimize distraction and background. If for some reason you accidentally bump the microphone and unmute yourself, then I'll go ahead and mute you. I hope there's no offense there, just to try to keep that background noise at a minimum. There are times when it is, we're asking if people have questions. You are more than welcome to unmute yourself then and ask questions. We definitely do want to hear from you. We just want to keep the background noise to a minimum. And then, as always, we hope that you know that we're really grateful for you guys and everything that you're doing. It's been more than a year now that we've been in this pandemic. It's exhausting. We hope that you're hanging in there, and we hope that you know that we really appreciate you, genuinely appreciate you and all that you guys have been doing on behalf of clients before the pandemic and during the pandemic. And even though we're meeting less frequently, we're still very grateful for you. And we'll continue to reassess. I know this is our first webinar where we switch to this monthly schedule. If it becomes needed for us to meet more regularly, we will do that. But hopefully you guys all appreciate having some more time back in your day. And yeah, we'll continue to assess and meet as frequently as seems to be needed for folks. But we hope that these continue to be useful for everybody. And so with that, we'll go ahead and look at our agenda for today. So we're going to have some shelter updates. We're actually going to have the health department updates come after the shelter updates. Then we'll have our system-wide updates that we'll go over, and then we'll end with a few resources that we want to share with you guys. And with that, I'm going to go ahead and jump us right in. So I'm going to turn it over to Lauren Licata, and she's going to kick off our shelter updates.
Good morning and happy Friday, everyone. Just a couple of quick shelter updates for you today. If we go to the next slide, please. So we currently have 0 symptomatic clients, and actually the number for positive clients at shelter type 2 should say 23. I think I mentally changed it, but didn't actually change the number. So we currently have 23 positive clients at our shelter type 2. Just a reminder that COVID is still going on, even though a lot of the restrictions are being lifted. And then Jane, if you are on the call right now, if you want to talk about the gift cards for testing, if not, I am more than happy to. Let me see if Jane's on here.
I'm here.
Hi, Jane. Do you want to talk about gift cards?
Sure.
Perfect.
Do you want to show the forms, or do you just want, should I just use this prompt to discuss it?
Yeah, you just want to use the prompt to discuss it, and then we'll send out the forms to everyone.
Awesome.
Perfect.
Okay, so the I'm sure people are familiar with the gift cards that were distributed, or many people are, over the last year, that were incentives to get tested, remain in quarantine and isolation if indicated. Well, this is a reiteration, resurrection of the gift card initiative. It's a slightly different because the previous iteration was a contract between United Way and the city of Detroit, a subcontract between the city of Detroit and Southwest. Southwest is now the direct contractor with United Way. So that's changing. I don't know if that'll even be obvious or anyone will even care about that. Anyway, here's the bullets. Each individual, everybody can read, but I'm going to do it anyway, so it makes me feel important. Each individual, including every member of a family who gets tested and receives the test results, gets one $25 gift card. I don't think that's any different than the previous initiative. Now, the next is different. Each individual, including every member of a family who maintains their isolation/quarantine when required, will receive $25 for each day they maintained isolation, up to a maximum of $250 per family. That's a giant difference than the previous initiative. Facility requesting cards must send an email to the email address on the screen as follows: subject line, name of the facility, and just put gift cards order. Facility staff who pick up cards will complete staff signature page. Facility must submit client receipt per the instructions on the form. Is there any, I don't know if there's anything else to say. Lauren, do you want to add anything, or did I cover it? I mean, it's pretty straightforward. And when you see the forms, the staff signature page and the client receipt, do you want to show the client receipt? Is that possible? Just so people get an idea of what's required. Lauren, can you do that?
Yeah, let me send it to Katie really quick and see then if she can pull it up.
Okay.
Sorry, I was not prepared.
I wonder if I can do, I might be able to do it.
I can stop sharing my screen, Jane. If you know how to share yours, feel free.
Can I just say share screen? I mean, I need guidance.
Yep, you'll press the share screen button and then it'll have you pick what you want to share.
Great.
Share your screen as a whole or pick the specific document.
Okay, let me get the document up so you don't see how messy my desktop is. Hold on.
Okay.
All right, so that's good. Okay, bear with me. Okay. It didn't help, did it? Okay. There we go. Can everybody see?
I see a folder, yes.
Okay, that's not good. You should say client receipt.
I see the document, like I see the folder, like the document is in the folder, but I don't see the document opened.
Oh, okay. Well, it's opened on my screen, so that's a bummer, huh? Okay.
Can you, or do you have a dual screen?
Yes. Should I put it on?
Can you move it over to the other screen?
How's that?
There it is. Yep.
Okay, great. All right. Okay, this is the client receipt. So does anyone, I wonder, should I entertain questions from staff at facilities who will be completing this and submitting it? Is this a good time to do that, or should we just look at, I just want people to see what what's going to be required when they, what's going to be required of clients to complete and what's going to need to be submitted. And the reason it looks the way it does and it's asking these questions is because This is what the United Way, I like to back into what a funder wants us to report on. So I'm going to get it at the front end because to be quite frank with you, I'm not going to spend hours trying to recreate or try to get this information when the United Way report is due. So that's why I'm doing it this way. Anybody have any questions?
Can you zoom in a bit? We got someone requesting that in the chat.
Absolutely. Is this helpful?
I think that's good. Yeah, thank you.
And how do we get these forms?
They're gonna, when you pick your cards up, I will give them to you.
So I do have a question. I know it's $25 per person in the family, up to 250. Now, is that 250 per person, or just everybody in the family gets
Per
up to
family,
250?
per family, per
Okay,
family.
got it.
Yep. Which is drastically different if anyone was involved in the first round, which is drastically different than the first round. Was anybody on the call involved?
Yes, we at the quarantine site.
Yes.
We were giving away like $6,000 depending
Yeah.
on how many people were in the family. So this is very different.
Mhm. Do you have an opinion, or would you like to comment on the ceiling on the $250 cap?
Not really. Not really. I feel
Okay.
like for some families it kind of was beneficial because they needed it, but with the resources being limited, and maybe this was all that you guys could do, at least it's something. So I don't want to. I don't know. I'm just in the middle with it.
Sure. Well, I think that Tara and I just had some discussion around it, and this is not law, and it's not etched in stone. If we discover that the incentive does not meet people's expectations of what an incentive should be, we may have to revisit it.
Well, I think that it is good that you guys at least are doing incentives because, I mean, honestly, we shouldn't have to pay someone for their safety, but I understand with this population, it kind of is necessary. So the fact that you guys put together a plan to increase it, it definitely helps. And since we were having issues with testing at shelters,
Mhm.
maybe with their gift cards back again, everybody will participate and we can monitor the results better. So that's why I'm
Well-
also in the middle. I think it's a good thing. And I just think it's a little downfall, but it's still an overall good thing.
Well, you know what? And it's not, to be honest, it's not just this population. Look, people are trying to implement lotteries and prizes for getting the jab in the general population. You know what I mean? So money talks. It's look, Ohio's having a lottery, right? For people who get the COVID vaccine. So it's an incentive for everybody. Let's put it that way.
All right, so we've got 2 more questions, and then I need us to keep moving because we've got a
Okay. All right.
agenda
Okay.
today.
Bring the question.
So one question was, will this form need to be filled out for each family?
Yes.
Okay, perfect. And then the other question was, is it possible to have an electronic form to fill out instead of a paper form?
Absolutely.
Perfect. All right, those are our questions. Thanks, Jen.
Now, one thing, do you want me to convert this into a fillable, or can you manipulate it in Word? What do you prefer? The thing about fillables, go ahead.
I was just gonna ask, can it be manipulated to a fillable? It'll be easier.
They have to sign though. Yeah, sure. But we need a signature, but I'm not going to worry about if the signature is done in pen. If it says signed online due to COVID or whatever the case may be, I'm good with that.
Fillable we got another response for fillable in the
Okay.
chat too. So it seems like that's the preference.
Okay, so what I'll do then, when somebody orders cards, I will send the fillable as an attachment. I'll respond to the email when I let them know when to pick up their cards with the fillable as an attachment.
Okay, that sounds great.
Yeah, because there's no need to just blanket throw this out there because you only need it if you're getting cards. Right?
Yeah, that makes sense.
All right, thank you.
Thank you, Jane.
Mhm.
All right, now I'm going to turn it over to folks from our HMIS team who are going to talk. They've been working to collect data on our vaccine efforts, and they're going to share a little bit of the data they have so far with us.
Good morning, everyone. I am Violet Ponders. I don't know if Tamara's on the call, but together we're working as a vaccination coordination team. Can I have the next slide, please?
Absolutely.
And what we are doing is right now we're inputting old data from the city of Detroit for vaccines that have been completed. And then we're entering new data for vaccine clinics as we find out about them. We have a partnership, or the city has a partnership with CCIH, Central Cities Integrated Health System, and they are giving vaccines. My understanding is we're also going to be working with the health department. And as they go out, we will put information into the HMIS system for people who are in the homeless system that have completed the vaccines. As you can see, our total population at this point is 7696, and that population changes as agencies' populace changes. Of that number at this point, we can confirm that 158 have been fully vaccinated, where 147 have had the first dose. Second slide, please. Next slide. This breaks down the project type and the fully vaccinated numbers that we have thus far. As you can see, the largest percentage of people that are vaccinated actually come from the other category. And that other category is a combination of a lot of different things, well, several different things. The next largest category is the day shelters. After that is transitional housing. But as you can see, for our average, we're still hitting about 90% that have not been vaccinated. We think that number is lower, but we've got to do some more research to verify that. Next slide, please. The majority of the clients that are being vaccinated they're getting the Moderna vaccine. Next slide, please. Next slide, please. You went backwards. I need you to go forward.
All right, I know I'm trying to unmute because we had a question that came in. Someone asked
Oh, okay.
who all was included in the other category.
There are some, they're not exactly day shelters. There are things like Motor City Mittens. It's projects such as that.
Perfect, thank you.
The largest number of vaccines have been given by the Detroit Health Department. Central City Integrated Health is just now getting into the programming of giving vaccines to the homeless community officially. So the Detroit Health Department numbers are from previous vaccine clinics. We're hoping to update that, and Central City, we're working with them as they go out now. I just got a message that says some of the others were also PSHSROs. Now, what we plan to do in the future is to contact all of you to see if we can get any additional information on past vaccines. The technology team at hand is wonderful. And Lauren has come up with a booking system to schedule education and vaccination clinics. We're still working on that, and we'll introduce it to you as soon as it is completed. We're going to continue to input past vaccine information as it becomes available. And then we're going to participate in vaccine clinics to input client data as they complete it. Tamara and I's emails are there. If you have anything that you can contribute to this, vaccine information on a new vaccine clinic that you are going to schedule, please let us know. and we'll be happy to come out and work with your population. Next slide.
We have a question from someone asking if you know how to get someone a replacement vaccination card. I'm not sure if that would be in your wheelhouse. That might be more in the health department's wheelhouse, but I just wanted to throw it out in case you did know the answer.
I do not have that information. I'm sorry.
So this is
It's okay.
CERA. I'm from the health department. When they go back to get another vaccine, they have to be looked up in Maker to confirm their vaccine dates and everything like that. They'll be able to provide them a new vaccine card at that time.
Perfect, thank you. And that looks like that was our last slide. Was there anything else you wanted to say on that before we transition to the next segment?
Yana, Lauren, you all like to add any comments?
Well set, but when we do roll out the bookings, those folks that are at shelters will get a full rundown on how to utilize the system to best serve your needs to get as many folks vaccinated as possible. Thanks, everyone.
Perfect, thank you. All right, now we're going to turn it over to the health department. They're going to give us some updates. Alexis, I'll stop sharing my screen so that you can.
Hi, everybody. This is Alexis Adams. Can you hear me okay?
Yep, you sound great.
Okay, all right, great. My name is Alexis Adams Wynn. I work at the health department, been overseeing our operations for rapid testing and now PCR testing for almost a year now. I've been with the health department for nearly 4 years in September. Prior to COVID, really, I was leading our strategic plan, and prior to that, supporting our now Chief Medical Executive, Dr. Jonay Calhoun. So really enjoyed my time at the health department, and I've particularly enjoyed the COVID testing that we've done so far. We wanted to join you today to just kind of do a meet and greet, just share some overall information about the rapid clinic and lab operations at Williams Recreation Center, answer any questions you have, and also kind of just share what's coming up in the next couple of months. So in case you don't know, the Rapid Clinic is located at Williams Recreation Center at 8431 Rosa Parks. We have hours from 7 a.m. to 4. We do need an appointment, so I'll talk a little bit about how we can arrange walk-on appointments, but the appointments just allow us to plan for the day. We have limited parking spaces, and we're also trying to make sure COVID protocols are followed as well. There's about 55 staff on site, both clinical and non-clinical. We perform sometimes around 3,000 tests a week. So right now we're kind of seeing a decline in testing since the surge a couple weeks ago, but around 1,500 to 3,000 tests that we perform every week. If you have clients or family, staff, whomever interested in scheduling a test at Williams, they can call for a rapid test, 313-251-4488. And we also have PCR appointments available. That number is 313-230-0505. That's also the same number for the vaccine appointments. We're piloting something new at Williams where we'll have vaccines on site. This is something we just started, and we hope to build out as we
Morning,
notice
Jane
that
speaking.
people coming on site.
Yes.
I'm sorry.
Okay.
Were you trying to reach me?
I think she might have accidentally unmuted herself. I'm just going to mute her again.
Sure.
Oh, okay. All right. Again, the vaccines we're co-locating with testing. As we noticed, people, they're coming for testing, for rapid tests, they test negative. They can be persuaded in the moment to get a vaccine. So we're seeing some success there, but we want to build that out. The site also has Meet Up and Eat Up Monday through Friday. I also want to introduce Dr. Michael Mossing. He's on the call as well. Do you want to do a quick introduction?
Sure, I can jump in. I'm Mike Mossing. I spent a career as a molecular biologist and retired recently, but joined the CDC Foundation to help with coordinate testing here in Detroit. I've been here since June, and I've really enjoyed helping to keep everything on track and sort of advise on the technical aspects of things.
Thanks, Dr. Mossing.
Sure.
And so, we've been testing for several months now. I just wanted to also introduce you to the testing team. So these lovely faces are the nurses and medical assistant who come to your site. They enjoy coming to the site. They've also, I think, worked as temp check screeners at the site, so they're very comfortable and familiar with the locations that they're serving. These are the faces behind those masks. So I want to turn it over now to Dr. Mossing to just talk high level about the ID Now nucleic acid amplification tests that are the rapid tests that we perform at Williams Recreation Center.
Sure, thanks, Alexis. Yeah, so the tests we perform are from samples that are collected, so-called nary samples or mid-turbinate samples. So that's sort of in your nostril, but not way back in the nasal pharyngeal tests that are collected for PCR. It's quite a sensitive test. It takes about 15 minutes to run. So the outreach team will collect the swabs, bring them back to our big lab facility where we've got about 30 machines and people to operate them. And we can process lots of samples quite quickly. The rapid test is not quite as sensitive as the PCR test in most cases, although there's some variation from sample to sample, but I think it's quite reliable. It may miss a few cases that have very low levels of virus, so very early in infection, but positive cases I think have been proven out to be or positive results have been proven out to be quite reliable on that test. So I think we've got a good system and very capable operators sort of running that test, and you can trust the results.
Dr. Mossing, could you also just share about, we get questions about vaccination, individuals who've been vaccinated and testing positive, and kind of what that looks like on our side, and why that might be?
Yep. So I think, so first of all, I think it's been shown definitively that the fragments of viral RNA that you get in the Pfizer or the Moderna vaccine are different. They have nothing to do with the viral RNA that's detected in this test. So you can't get a false positive from a vaccine injection on a rapid test or any certified or emergency use authorized COVID test. We do have a few breakthrough cases, and we're still understanding. So that breakthrough case is a case where somebody tests positive after 1 dose of vaccine, and in a few cases even after 2 doses and 2 weeks of vaccination. We're still studying to figure out exactly what those are. In all the cases that I've seen documented, they have not resulted in serious illness. Very few are symptomatic, and I think the way I interpret it is that the range of viral levels that are detectable in this rapid test is probably over 10,000. So a person uninfected or unvaccinated at the height of their infection may have 1 million viral particles on a swab that we take. But you will still test positive sort of down to 1,000 viral particles on a swab. So I think probably in all of these breakthrough cases, there's enough virus there to cross the threshold to make it positive, but probably it may only be 1% or less than 1% of the virus that is present in a full-blown infection. So, so we do see a few breakthrough cases. In general, those people aren't very sick. Mostly they're not symptomatic at all. And I think the best indication, and we're really learning as we go along, is that they're not going to be very infectious. I mean, their probability of passing it on is going to be somehow proportional to how much virus they have. And it's going to be a small fraction of what it would have been had they not been vaccinated.
Thank you.
Sure.
So we wanted to just kind of share some pointers or recommendations for preparing for the testing appointments that we have. CERA has set up for you all. So just wanting to increase participation, some of these things you might already be doing, but just things that may help the process go a little more smoother. And just if you have other recommendations for how we can improve the process, I have my contact information at the end of the slide. I would love to hear from you. Really open to making changes as needed for your biweekly testing. So just some recommendations. As we've gone out to sites, our nurses have stated staff and clients have told them that they have not known that we were coming on site. So a recommendation there may be posting and printing schedules for staff and clients just so they're aware and they're not caught off guard when we arrive. If possible, and this is something we had brainstormed with with a shelter that we do testing at, scheduling testing around a special meal or activity just to make sure clients are actually on site. Giving shout outs to clients and staff who are participating in testing. We do provide testing to staff. There's some sites that take advantage of it, not all do, but we think that it would be also a good example to show clients as well if you see staff also being tested. Arranging for on-site testing at Williams Recreation Center. So this is something new that we're trying out. CERA, I think, has shared a few sites that have kind of needed off-week testing. Also, the process right now, because it's not really something we want to take the place of our scheduled testing. But if you need testing of a new client or staff, something that's urgent, please text me and we can certainly make arrangements for them to be tested on site and sometimes same day. If you have feedback on testing time, so we were at a site yesterday and was told one of the reasons why we're not seeing more clients is because this is their time that they're sleeping. So it's something, we don't know when we're making these, schedules. If you have feedback on if we need to make some adjustments, I think we're willing to do that. If it's going to mean we're going to be able to test more people, we want to make sure that we are accommodating. One really important thing, and I know it can be a pain point for people, but the line list. The line list that CERA is asking for the day before testing is so important, it's so critical that we get this information ahead of time. We want to make sure we can prepare labels and bags ahead of time for your clients and staff that have their names spelled correctly, birth dates, correctly, so we can minimize the errors on their results. Also, it really just shows clients that we care when we have their name, printed on a bag and they're ready to be swabbed. So it makes it a really efficient process. We've had clients share with the nurses, you know, week after week, we've come back and their name is not on the line list. And it, you know, it's just not a good feeling. So another reason why to make sure these line lists are completed a day before. If it's helpful to set calendar reminders, I know CERA is very on top of sending reminders as well via email. As we're looking through the list, we do clean these lists because we have to take this information and put it into a form that is shared with the state. So we have to report every test that we perform. And so I've noticed, and we've noticed as we're cleaning these lists, there are some staff that are taking the time, and I know it's painful, but they're typing in every bit of information instead of using some of the shortcuts in Excel to just copy information. And so you get, you know, errors in spelling of, you know, the city or, you know, just, it would be a lot cleaner and a lot faster and more efficient if we could teach those folks who are preparing the line list some of those shortcuts. And I'll demo one of the new line lists that we're going to be sharing with you at the end of the day. By the end of the day, you'll get a new line list that hopefully will make this process a lot easier. Also, making sure you're building the line list from previous lists. It's okay if you know one client has left and you're just quickly needing to add another client. Don't worry so much about the individuals who are no longer there. It's really capturing the new clients that are on site that we need to anticipate testing. So just adding them. You can pull from information that you're already maintaining. If you have lists, copying and pasting that information from one list to the next could help. Again, just putting that information into your list for the upcoming week, you know, as soon as clients arrive, help. Another thing that may have helped the last testing we did in a particular shelter, we arranged for our education team to provide a presentation prior to testing. I think there's a lot of questions about the vaccine and whether testing is necessary still. And so we just want to clarify some of those reasons and, you know, increase motivation for testing. So the education team would be happy to come out to your site. So a few updates, and then we'll be wrapping up the results delivery. So we noticed that there's some sites occasionally, you know, we've dropped off results, but the site can't find them. So we've instituted a delivery log that whomever at front desk or whoever the facility manager is on site or supervisor is signing off on those results, that they've received them and the time that they've received them. We are working to make sure we have 24 to 48 hour drop off. And we also offer same day pickup at Williams Recreation Center. So if you have an urgent need, a client needs to get their results to return to work or school, we're happy to arrange that. Just give us a call. Again, I talked about the walk-on testing if needed. And we also have a bid being posted from the city to look at having PCR saliva testing. I think people we've talked about we're tired from this pandemic. I know clients are tired of being swabbed, so we're looking at something more non-invasive and some saliva testing that would allow us to report results within 24 hours. It's coming online soon, so I'll be happy to come back when we have that ready to go in the next month or so. And it sounds like gift card incentives, there might be an opportunity to get double gift cards. So we recently submitted a proposal for funding gift card incentives for testing. It would allow us over 2 years to provide testing incentives, gift cards of I think it's $20 to $25 every time the person tests. And so we do biweekly tests. So, you know, I think that's going to go over well. We also have the ability to print appointment cards that we can give out. between testing. So clients also have that in their pocket. They know that, hey, we'll be back. The health department's coming at this date and time. And then the pre-filled list. So I'll show you that in just a moment. But if, in the sake of time, if you want to take down our information, if you have questions, again, this is my cell phone. I didn't put Dr. Mossing, I didn't put your cell phone on here. It's your personal phone. I don't have a work phone for you, but if you want to take down my cell phone, feel free to text me. If you are looking for results, if you are looking to add on somebody for testing at Williams, I'm happy to make that arrangement. And you can also email me. Give me 1 second. I'm going to pull up the line list.
Perfect. And we will have to move to the next segment super soon. So just want to make time for
No problem. No problem.
I have a question real quick.
Okay.
So we had received a family from another shelter, and when you guys came out to test, they had informed the staff that this family was at another shelter, and they had just tested them at this other shelter, and that family had tested positive, but the health department didn't have a way of tracking that family. So they had been at COC for probably a week, walking around, with test after testing positive, because we didn't know that they had tested over at the other shelter. So is there any, and I don't know if this will be on who's end, but some type of way when they're coming from those other shelters, if they're testing, to communicate that with the next shelter or whatever agency that's going to be working with that family?
From my
Kira, did you want to take that? I
understanding,
think.
yeah, from my understanding, that is supposed to be a HMIS. So like if we have a family who tests positive, let's say from YWCA, another family shelter, and if they get their results and they decide not to quarantine and they try to come to another shelter, the shelter manager from YWCA would communicate that with HMIS so they can put them in the system as being positive. And all of the shelters they try to go to, they won't be admitted to because they know that they are positive. As far as someone that you spoke to at the health department, I'm not sure who that was, because if you provide me their name, and we could do this offline, but if you provide me their name, I can see what shelter they possibly came from, as long as it's one of the 29 that we service. If it's outside of that, then I would not know those results. But if it's one of the shelters we provide services to, I'll be able to pull that family up. And but usually that HMIS is supposed to log and keep that instance to reduce the amount of people being exposed.
So this young lady, after her family left, before she left the shelter, she didn't get her results back. So I don't know if it may have been recorded after the fact, but if she was tested and then she ended up leaving that shelter and coming to COC. So the person who told us, it was just, our contact person who was in contact with the health department, she was just like, oh, we had been looking for this family because yada, 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 yada. And so that's when we made, the communication with the health department. And she did actually go in quarantine once they found out, but it had already been a week that she was at COC. So just going forward, if it outside of, because I know sometimes it takes time. So if they end up leaving before that information is documented in HMIS, that's something that all the agencies that's working with that family should know.
Yeah, I totally agree. And we can talk about this offline again too, because I know they have to move forward with the segment. So I'll get in contact with you.
Okay, thanks, Tiara. Just to just quickly, if you can see the new updated line list, just sharing with staff that they can basically copy the information down by pulling that little drop down there and updating the time, the date to whatever date that we're coming out for testing. This information in the middle will need to be updated, but for the most part, the rest of the information can remain the same. This is specifically for clients. So for, the address, you don't necessarily have to put this. I've seen some sites putting in the individual unit number. You can skip that portion. This information, again, drop down. I've made drop downs for some of these categories here. That'll make it a little bit easier to make sure the information's recorded correctly. We have to conform to the state's categories for race, Hispanic ethnicity, and Arab ethnicity. And so that's why those will be filled in, and you'll have to select one of these drop downs moving forward. So this area I want to just kind of call your attention to, if you have staff who are being tested, we do need to know their home address. When we don't have it, we're putting that information in as the site that they were swabbed, but it's important that we record the location where they reside, because if it is a positive, or even if it's a negative, it's recorded for that location instead of the city of Detroit and that particular zip code. And then this last box, so again, these are now drop-down options, and you could still do the drop-down to just quickly fill that information in. And then when you get to resident and staff, sometimes I see this filled in, sometimes I don't. It would be great to have that information ahead of time. And then when we print these lists, our staff will have another column to record symptoms, because, if you're doing this a few days ahead and symptoms come on site, the day of testing is really where we're looking at. So our staff will start to fill that in when they come on site. So you won't need to complete that. So I'm hoping this will make it a lot smoother and easier to fill this out. If you have other recommendations for improving the forms, let us know, and I'll work with CERA to get this out to you today. Were there any other questions? All right. Thanks a lot.
Thank you.
We appreciate it. All right. I'm going to keep us moving. So we're going to jump into our system updates now. I'm going to turn it over to Catherine, who's going to give us a brief update about HCV.
Thanks, Katie. Hi, everybody. This is Catherine from the CAM. Just a really quick update on HCV stuff. So far in 2021, there's been 548 total Detroiters experiencing homelessness that have been pulled from the homeless preference HCV wait list. So we all know lots of pulls happening. So that's a lot of people that are being pulled as of May. We anticipate pulls continuing to happen monthly. And I just wanted to share some data specific to the most recent poll that MSHDA did, which was on April 16th. So there were 133 people that were still active in CoC programs at that point. So essentially meaning like they were in a shelter, working with street outreach, or in a rapid rehousing or TH program. And of those 133, there's been 80, so 60% that have submitted their initial paperwork packet to the MSHDA agent. I'm assuming at this point the 60% is probably a little bit higher than 60%, but that's about where we are at this point based on feedback that we've gotten from RPI and CMA, which are the two agents that did the poll in April. And so if you're working with anybody who has not yet submitted their paperwork, if they say that they haven't received their paperwork, whatever the issue is, feel free to let me know if they need new paperwork. If they have it and they just haven't submitted it, make sure they get it in, because people are on different deadlines, but there's a lot of people that have May 26th as a deadline. And I think the latest is June 2nd. So we should really be shooting for May 26th for people to submit that initial paperwork in. So they've got until next week, basically. So if you have anybody that you need that like didn't get their paperwork or whatever, please let me know, so that we can make sure that to get them a copy from the MSHDA agents. And then also just a reminder about the HCV office hours. So we hosted the first session on May 13th, and this is like office hours with those MSHDA agents for people to be able to ask questions and stuff. We're planning to do another one on June 10th at 1 p.m. I'll send out more information about that, but I'm going to send out a survey to people because I think that there were definitely like ways that we could improve that first one. And so expect a survey from me later today or Monday about that. And please complete it if you want to provide feedback on like how to make those office hours as effective as possible with the MSHDA agents. And then just based on people's feedback, we'll probably schedule another one for June 10th. So, and again, any questions about like HCV stuff in general, please contact me directly. You can email, if you have my contact information already, feel free to reach out to me, or you can always use the camdetroit@swsol.org email address that's on the screen. Any questions?
Not seeing any in the chat so far. All right, we'll keep it moving. Thank you so much, Catherine. Thanks for the update. All right, I'm going to turn it over now to Tasha, who's going to give us some information about CERA.
Hi, good morning, everyone. Tasha Gray with HAND. Just want to share a bit of information about the COVID emergency rental assistance that is available to City of Detroit, Highland Park, and Hamtramck residents. You all may already be aware that the program opened in March and is actively accepting applications through the MSHDA portal. That portal can be accessed at the link below on the Wayne Metro site, as well as going directly to MSHDA's site. The program is scheduled to end in December, so these resources are available, but it is a limited time that they're available. If you are aware of people who are in need, we encourage you to have them visit the Wayne Metro site where they can begin filling out the application. So the Emergency Rental Assistance Program, it provides not only rental assistance, but also utility assistance to folks who may have fallen behind in either rent or utility as a result of COVID. So people have to be able to demonstrate what's called a COVID hardship, and that could include loss of a job or significant reduction in income as a result of COVID. And then they, of course, also have to be renters in Detroit, Highland Park, or Hamtramck. And then the household would have to be below 80% area median income to qualify. So for a family of 4, for example, that would be about $62,000. So the partners that are implementing the CERA program, you see there in the middle, there are some legal services that are available as in addition to the financial and utility assistance. So we have some of our legal providers that are heavily involved, including Lakeshore Legal and Michigan Legal Services, as well as United Community Housing Coalition. And then we also have some of our partners who are implementing the financial and utility assistance. It is one application, so you can fill that application out. You don't need to call partners individually. You just fill out the one application. If a person is having trouble completing the application or may need some assistance, they can call the number that is listed there, the 866-313-2520, and they will be scheduled for an appointment with one of the call center staff in order to complete the, in order to complete the application. So, like I said, the program is accepting applications, but it is, the a lot of applications are coming in. And so be patient. There's definitely a backlog that folks are working through in order to process the applications. So there are resources out there. If you know of people who are in need of these resources, we invite you to participate in the program and share the resources. And like I said, just exercise a little bit of patience because there is a bit of a backlog. Are there any questions?
We got a question in the chat asking if CERA is prioritized.
So there are some priorities. People are in court are being prioritized first, and they are being prioritized by, I believe, their court date and also how far they are in the court process. And then we are also trying to work through a process of prioritizing people who have their utilities shut off.
Perfect, thank you. That looks like the only question that's come in the chat. Okay, not seeing anything else. Thank you again, Tasha, for the update. We appreciate it. And so this slide here, I'm not going to spend a whole lot of time on it. We just wanted to remind folks about vaccine access for any staff who are interested in vaccines and have not been able to get vaccinated yet. Walk-ins are available for vaccinations. On the slide, which you guys all have access to, you can click on the link to the map of the different locations. There's also a location list. And on this slide, there's details about what is needed to get that walk-in vaccine. And so we were going to do some data on the CAM annual report today. It's been released, which is very exciting. We were going to talk about a few key takeaways. However, we recognize that there's 2 minutes left, so we'll push this one to our next webinar. And so we'll share all of this exciting data with you guys at the next one. I did want to let the HMIS team give a plug because they were just going to let you guys know that we're also going to be sharing some PIT and HIC data soon. So I'll turn it over to folks on the HMIS team to briefly talk about what's next for PIT and HIC.
Thank you, Katie. So as you can see, the housing inventory and point in time counts have been completed and submitted to HUD. So we completed that on May 14th. We haven't had anything back, so usually we wait for like some things to come back if anything want any more updates on any questions they have. But other than that, it has been submitted. So thank you so much, everybody that participated in that. We're able to get emails back in a timely manner. So yeah, once the data has been formatted for publishing, it will be available on our Hand Detroit site, and we will make sure all those records are put on there so everyone can see the updated data. Also, the HIC and data will also be reported out during the next CLC board meeting on Monday, June 7th from 2 to 4:30 p.m. So if you are on that meeting or on that call, you will hear it firsthand at that meeting. And for notification on the PIT HIC data postings and other happenings at hand, subscribe to the newsletter. The newsletters are great. Newsletter to show what's happening in the CoC and with the HMIS team as well. So it'll be in that newsletter coming up next. So we just want to make sure everybody knows where they can find these things once they're available. And we just want to thank everybody again for helping us with the PIT HIC this year.
Wonderful, thank you, William. The last thing we have for you guys is resources. This is the flyer for CERA. I can work with Tasha to get a flyer that I can include as a separate attachment into the folder of resources so that you guys can download that and share it. And then there's some information about stimulus checks and the child tax credit. There's a new website from Poverty Solutions for that. I'm not going to spend a whole lot of time on this slide. I'll let you guys read that on your own, just knowing about time. The last thing I just wanted to bring to your attention is that we have a training coming up in our ongoing partnership to to better coordinate the homeless system with the workforce system. And so there is a joint training that we're hosting on June 3rd. There's more details about that training here on this slide, as well as a registration link. Information about this went out in Han's most recent newsletter. I know Cam also recently sent some information out, and then it's here on this slide. And so here is no, that doesn't work. I was going to put the link to the registration. It wasn't letting me copy it, but the link is on the slide. So feel free to click on that. With that, I know that we are at time, and I want to respect everyone's time today. So I'll hang on for a couple more minutes if there's any lingering questions. Otherwise, thank you guys so much for joining us today. It was really great to connect with you guys, and we're looking forward to connecting with you